Hello, my name is PJ Blois, and I'm here to explain the role of health promotion and education in cancer prevention. I'm well positioned to speak about this because I studied a master's degree in education leadership after my Bachelor of Science. I've been participating in the 2020 to 2021 Cancer and Evolution Symposium, as well as the USC Ellison Insights in Medicine forums. I've been reading and writing academic literature about advancing biology cancer curriculum over the past few years, and the literature indicates that cancer can and should be prevented by addressing environment and lifestyle factors. Many people are not aware that beyond the problems of smoking, pollution, and pesticides, lifestyle choices such as exercise and diet and environmental exposures, including infections, determine risk of cancer. Genetics are only responsible for a small fraction of cancers, whereas the majority are due to lifestyle and environmental factors. Therefore, we should avoid or reduce exposure to carcinogens, the known or probable causes of cancer. We should curb infections through vaccination, abstinence, safe sex, and safe injections. And we should be aware that traumatic and chronically elevated stress may cause DNA damage. Education can help reduce cancer incidence by increasing awareness of how it can be prevented. Of course, everyone knows about the dangers of smoking. It's here on the right. Next is a group of factors that people are not necessarily as well aware of: poor diet, sedentary life, obesity. So exercise is related to cancer. Obesity, independently of exercise and health, is related to cancer. It's related to inflammation. We're going to talk more about that. This red one, not many people know about this, but early childhood adverse events also can cause cancer. Of course, it could be because behaviors are influenced. There could be alcoholism, drug use, people not taking care of themselves, all because of how they were treated as a child. Infections is tied there at 8%. Everyone knows about that. Infections might cause directly or indirectly, and we're going to talk more about that as well. There are 150 types of professional exposures here in blue, and we're going to list some of those in this presentation. Age, I put there as a factor. Many people have noticed that people are getting cancer later in life. And so that's going to be a factor here as well. Alcohol is there in purple, 4%. Air, water pollution, pesticides, that's over here. This one that is missing here, that's heredity, genetics. Okay, it's not playing as big of a part of the puzzle as we used to think. It is there, of course, 4%, but the point of this presentation is to focus on the factors that we can influence. And so I've even taken it out of the pie. Household fumes, for example, from cooking, coal, all those things, 4%. UV rays, X-rays, you've all heard about them. We're preventing skin cancer. Low socioeconomic status, these people maybe have less privilege, and there could be some depression that goes with that. Lack of cleanliness, lack of access, 2%. Reproductive and perinatal factors, even breastfeeding, for example, can help prevent cancer. We're going to talk more about that. Having children younger as well. Medicinal drugs, procedures, for example, diagnostic x-rays. This is part of a medicinal procedure that could cause cancer. So there's chemotherapies as well we're going to talk about that can cause cancer. Lesser known, ELFs, EMFs, they've been linked with some types of cancer. Wi-Fi has microwave, all right. EMF refers to electromagnetic fields around all devices. The one that most people know about are the high power lines. And last, traumatic stress, something serious, bereavement, 1%.